This is Boston College School of Social Work's Racism-Based Violence, Injury, and Prevention Lab. This video discusses one of our publications, titled Police Violence Exposure and Associated Health Outcomes Among Latinx Adults in the United States, an integrative review, co-authored by Dr. Robert Modley, Priti Patel, Hee-Ju Roh, and Dr. Danielle Walker. The study was published in the journal Trauma, Violence, and Abuse. This study explored the mental, behavioral, and physical health impact of police violence exposure among Latinx adults in the United States. An integrative review of 11 published studies was conducted to study the associations between police violence exposure and health impacts on Latinx adults in the United States. Police violence exposure can be experienced directly, as a victim or an in-person witness, or indirectly through media, including videos, news reports, or social media. The study found that mental health outcomes in particular were heavily linked to police violence exposure, including specific associations to psychological distress, such as depression, anxiety, suicidal ideation, and overall poorer mental health functioning. In regards to behavioral health outcomes, the study found clear associations between police violence exposure and increased risk of substance use. Specifically, higher risk of alcohol use was associated with increased police violence-related distress. Finally, for physical health outcomes, the study found that higher rates of police violence exposure were associated with an increased risk of adverse physical health functioning such as diabetes and high blood pressure. Overall, the findings demonstrate that exposure to police violence poses a meaningful risk to the mental, behavioral, and physical health of Latinx adults in the United States. These results highlight the broader implications of police violence for population well-being and inform directions for future research, practice, and policy. In conclusion, this study demonstrates that exposure to police violence represents a significant risk to the mental, behavioral, and physical health of Latinx adults in the United States. These findings call for culturally responsive intervention strategies and policy reforms that reduce violent police encounters and address the broader health consequences of police violence. If you're interested in learning more about this research, click the link in our caption or scan the upcoming QR code.